Herpes multiplies by transcription, genome replication, and capsid. It occurs in the nucleus of host cells. Right now, there is no cure for herpes, but it can be treated with an oral antiviral medication such as different medications. These treatments help assist in treatment outbreaks and if used constantly can suppress the outbreaks. The best way to avoid getting oral herpes is by not kissing anyone, share lip balms, or drink from other people's cups. The best way to avoid getting genital herpes is by not having any sexual contact with people who have herpes. Some signs and symptoms of the infection vary between people, but the first symptoms of herpes is tingling, stinging, or burning sensation in the skin, followed by an outbreak of fluid-filled blisters which appear on skin. Initial outbreaks of genital herpes can cause flu-like symptoms such as a fever. Women can have more severe symptoms from genital herpes outbreaks such as muscle pain, lower abdomen pain, and urinary difficulties. Some people also demonstrate signs like muscle headaches, aches, headaches, flu-like symptoms, and swollen lymph glands.
Herpes outbreaks come in two stages, primary and recurrent. During the primary infection, the blisters can break and eventually cause the first exposure. In the recurrent phase, the outbreaks are far less severe and the initial primary infections and are initiated by various factors such as stress, excessive sunlight exposure, and fever.
The origin of herpes in human is unknown, but herpes simplex was first documented by the ancient Greeks as sores that seemed to creep over the surface of skin. Vigil in 1873 first demonstrated the herpes simplex virus to be infectious caused by human contact.
2,000 years ago, the Roman emperor tried to cure the epidemic of herpes from the mouth by banning kissing during public ceremonies and rituals.
Annually, 776,000 people in the United States get new herpes infections. For people from ages of 15 to 49 years old, an estimate of 536 million are living with type 2 herpes in 2003. Out of that, 23.6 million were newly infected. In 2006, 71,000 people in the United States had genital herpes, compared to 1966, only 19,000 people. The majority of people with genital herpes was caused by type 1 herpes, which was contracted through oral sex. Not a surprise, more women were infected than men. About 50 to 80% of American adults have oral herpes. 90% of children in undeveloped countries have type 1 herpes antibodies.
The CDC, or also known as Centers for Disease Control and Prevention, estimates there is about 19 million new STD infections